Well, welcome everybody to our very first CC event live here in Innovation Hall, and we have some brave souls here in person. Today our event is going to focus on day one and the programs they offer to adolescents who are dealing with substance use disorders and recovery. And it's a really exciting program for you today. We'll do a case study, we'll have breakouts, it'll be great. What we ask for your patience with today is that we are presenting this event in many modalities. So we have in-person with folks with laptops who are going to participate in the chat. We have people who are live streaming in. We have folks on the Biddeford campus participating. We have Facebook Live. And I can't tell you how many things we're juggling to make this possible for as many people to participate. I am Shelley Cohen-Conrad, and I represent the Center for Excellence in Collaborative Education, which will be bringing you lots of events this year, both in person and by Zoom. So let's get started on this event, and it is my pleasure to introduce Dr. Jeff Ahlberg, who is the medical director at Day One. Jeff?
Thank you so much, and I want to underscore the myriad of different ways we bring messages to each other. We were here about a year and a half ago, and mostly in person, but we had some live streaming back then as well. So as we all know, the world has changed quite a bit. But yes, I'm Jeff Ahlberg. I'm a family doc. I've been medical director for Day One for about 2.5 years or so. And I must say that what Day One does represents a lot of passion by a lot of different people to try to do the right thing for our citizens and primarily our adolescents. Day One's been in existence for well over 40 years, which is, as we think of it, it's a long time for a nonprofit to be doing such type of work. The central theme has always been adolescent substance use, certainly with co-occurring mental health and other issues there. We represent a number of different approaches to how we care for our adolescents, as well as now caring for adults and family members since our merger with Smart Family and Child Services about 1.5 years ago or so. I'm merely the medical director. I'm here with a team from Day One. I'm going to ask the team to introduce themselves and a little bit about what they do in the Day One realm, and then we'll work through really a story about one of our clients that I think is going to represent a lot of what we do, and it's going to be, I think, very interesting for you to hear and visualize what this is that we do. I'll say right up front, the story we're going to bring you is truism. It's what we see in the work we do, especially in our residential facilities. And we're going to invite you to have some feedback after you hear that story as well. So you can read our mission and vision statement, but in short, the way I look at it, we're trying to improve the lives and keep our adolescents and young folks as safe as possible so they can go on to live both the current wellness lives, but also to become a statistic in a positive way down the road, certainly not in a negative way. We all hear about the problems with substance use these days. So it's one more small part of what we do for the overall community, but it's so important. And we invite you and all your different disciplines to help us think through the best way to do this work and to be advocates for us. So next slide. Good. So we have 3 different offices. You can read that. What I'm going to do now is ask our other team members to introduce themselves and talk a little bit about their domains, and then we'll get going with the next part of the program. So I'm going to ask Stephanie, can you introduce yourself and say a little bit about what you do?
Hey there, I'm Stephanie Carreau. I actually graduated from UWinnie's Masters of Social Work program back in 2013. So I'm very excited to be here. I am the Chief Clinical Officer for Day One. I've been with Day One for about 6 months now, and oversee all of our clinical programming everywhere from our Biddeford office up to Charleston, Maine, where we are at an adult prison facility providing substance use treatment. So we span quite a bit of space in Maine. I'm also going to be manning the chat today. So I'll be in there talking with you guys as we go through. If you have questions or anything, I'll certainly be able to answer those as we go.
Thank you, Stephanie. Kristen, can you say a few words about yourself?
Sure. Hi, I'm Kristen Sinelli. I am the program manager of Day One's residential services. I also graduated from UNE back in 2014, which feels like a long time ago now. And I am going to share just a little bit more about residential services as we come up later in the Zoom here.
Well, thank you, Kristen. And Cheryl, a couple words about who you are and your world that you work in.
Sure. I also am a UNE graduate. I graduated in 2005. I'm the program manager and a dually licensed clinician for the Day One Street program. Our office is located in the Preble Street Teen Center. We provide mental health and substance use outreach and low barrier harm reduction based counseling with homeless youth. And I will tell you more about our program and our case study as we move through our presentation.
Well, thank you, Cheryl. And last but certainly not least, Rich, if you say a couple words about your role on Day One.
Afternoon, I'm Rich Abramson. I'm not a graduate of University of New England, but I do have a connection to it, and you'll meet my daughter, Trish Mason, later in the program. I'm the education director for Day One, retired school superintendent of 19 years, and have been involved with substance abuse programming for these youth that we'll talk more about later for the past 19 years. So looking forward to sharing more with you later on.
And thank you, Rich. All right, before we get going, these disciplines that you see here are just some of the disciplines that our professionals that work with us represent. And what it represents several things. One is that, you know, our adolescents and adults that come to us have multifaceted needs. It's not just about the substance use recovery. It's all these other domains, including, as you just heard, educators, physicians like myself, case management, RNs, medical, pharmaceutical suppliers, all those med management. So, and a lot of these touch on the domains that you folks are learning and working in. So, you know, keep us in mind when you graduate and you're out there and you're looking for a very, you know, passionate career going forward. We can use many of these disciplines, folks who are specialized, as well as many others. So think of Day One as time goes on. So. All right, I think we're back to Kristen.
Yeah, so today we're going to just introduce to you a girl that we've all had a little bit of experience with. Her name is Emma, and she came on the scene for us well before 17, but we got to know her the best when she was 17 years old. So this slide just gives a little bit of a snapshot of where she was when we met her, and she was spending some time at the teen center. She was really struggling with homelessness. There was a lot of bouncing around between different people's couches, trying to find supports in the community that would house her. Parents were not really in a good position to support her. I believe there was some DHS involvement pretty early in her life that made that kind of inconsistent. And she came on our scene a lot because she had been struggling with her substance use, and that substance use had directly connected to some criminal involvement that she had been linked to, including property destruction and some pretty aggressive interactions with peers in the community, some of which had led to interactions with the police and some charges for assault. It was also clear at that time that there were really unhealthy interpersonal relationships, but also kind of consistent unhealthy relationships in the home that she had come from. And she was presenting with a history of self-harm, suicidal ideation, things of that nature. And we had heard from her corrections officer that there was a possibility that they would be seeking incarceration for her if unable to find some treatment. So that's sort of a snapshot of where she came to us from. So thinking of that, we're going to go to this next slide and just ask for you guys to consider whether you have come across the ACEs study. So I think Stephanie's going to drop a little something there in the chat box for you so you guys can share your experience with learning about the ACEs study. And just for a quick explanation, the ACEs is Adverse Childhood Experiences, and it was a study that they did early, I can't remember when it was, 1980s, I think, about the traumatic experiences that children have and how that impacts them later on in life. So they developed a screening questionnaire that helps us determine the impact of early childhood experiences on potential outcomes for folks. And that includes health problems, risk of incarceration, risk of substance use, and so on. So just an example of some of the screening questions. I think we actually have all 10. The screening questionnaire is just a 10-part, 10-question screening questionnaire, and it goes through things like sexual assault, physical assault, to neglect, to abandonment. And so that includes whether or not you've had recent deaths or someone who has been taken from the family by having to go to prison, and whether or not you have felt special in your life growing up. So how does that impact Emma? So Emma, when we did her assessment, we determined that she had an ACEs score of 9, which is pretty high. And that gave us a pretty clear picture that she had had some pretty terrible things happening to her previous in life. And that was before we really got to know the ins and outs of everything that had gone on. So this is an example of a few of the things that impacted her ACE score, including that both of her parents were incarcerated. She had personal physical abuse by her father, but also she witnessed a lot of violence in the home. And early on, the consistency of housing and consistency of having food source and things of that sort was pretty chaotic. So Emma spent a lot of time really being the parent in her home when she was really young. So in thinking about Emma's early childhood experiences and the pressures that she had on her, the impact of some of those ACEs, this is a snapshot of all of the people who had been involved in Emma's life even before she reached our desks to discuss whether or not it made sense for her to have treatment at residential or with Day One in general. She had contact with private child protective services. There were some hospitalizations for psychiatric concerns. She had been in residential programs previously. And as you can see, a multitude of different folks had been on board trying to provide some assistance to Emma. And at the time, she was sort of working with them on and off by the time she came to us.
So Kristen, I'll take this one, I guess. So what we'd like you to do is think about Emma, think about that story, think about her history, as well as think about her future and care. really an integrative approach that could be done to help Emma now and going forward. So we're set up to do both in-person groups as well as digital groups here. So I think we've got about 7 minutes for the breakout rooms. We encourage you to introduce each other, maybe have a lead for that group, and come up with some questions, share thoughts on this. No holds barred, and they would like to hear back. Well, depending on the time, we'd like to hear back from you, certainly in the chat room, but also in person if we can. So you may see one of us in your digital chat room. That's okay. Ignore us. We're not there to lead. We're just there to listen. So please speak freely. I think we might have a couple minutes. I think it would be, maybe we can get one or two questions or comments either from the physical audience or from the chat room.
Jeff, one of the questions in our breakout session was Emma accessed a lot of different services. Why did not one seem to prevail? She hit a lot of people, covered a lot of territory, met with a lot of different programs.
Yeah, I think that speaks to better support, recognition of all these issues, integrative approach to it that's consistent and durable going forward, and not to mention going back upstream, towards prevention of this occurring. Stephanie, did you pull a couple comments out of the chat room?
The only comments that we got about this was one of the takeaways was just needing to destigmatize substance use disorders and an overall sense of compassion for Emma and a lot of the life circumstances that came her way.
Okay. One of the things I heard in our chat room was a question, and it's a very good question. What's the fine line between a felony and being incarcerated versus an adolescent just crying out for help? And I think we're experiencing an overall sociological shift in that. We're seeing much fewer kids being incarcerated, and out in the communities, it doesn't necessarily mean they're getting better help yet, and sometimes it makes them harder to find. So that was a great question. So I guess can we move on to the next slide? All right, Cheryl, you're up.
So I'll just tell you a little bit about the street program, and then I'll talk a little bit about how Emma entered into our services and was ultimately referred to residential treatment. But like I said, the Day One Street program is housed within the Preble Street Teen Center. The Preble Street Teen Center is in Portland, and we provide 24-hour services to youth under 21. So the teen center is open all day, and then the Joe Chrysler shelter opens at night. So if a homeless youth chooses, they can stay sheltered and housed 24 hours a day. Within the teen center, we have a collaborative. We do the mental health and substance use and outreach. We also have something called the Street Academy, which is Portland Adult Ed, which is 2 teachers. So if youth are not following a traditional path in school, they can still obtain their high stat or work on employment. And teachers, are working to, of course, get youth enrolled or to complete their education. We also partner with the city of Portland, and they have a clinic, a medical clinic. So the goal is to get youth connected to primary care physicians, but we're also offering pregnancy tests, STD screening, and doing birth control and things like that. For me in my role, and right now it's one other clinician, we luckily have some grant funding, so we're able to kind of engage in some non-traditional mental health and substance use outreach with the ultimate goal of being able to support people clinically and getting their needs met. So I might have a few sessions with youth throughout the day, but then I'm also finding time to sit and eat lunch with the youth, to attend groups, to just be a presence in the drop-in, and to ultimately build a relationship. I think in some ways my role homeless youth are sometimes safer than youth that are in homes and using substances. We have eyes on these youth, and whereas high schoolers and stuff don't have aware adults knowing what they're up to. Some of our youth are actively using, have no desire to quit. We try to provide an open forum to discuss these things. And if someone is using IV drugs, we make sure that they are connected to the right people so that they can at least be using the safest way possible. And I would say, in talking about Emma, Emma's hugely resilient. And so we're saying, how did Emma fall through all these cracks? Well, Emma enters the teen center at 15 and has already been in the system so long. So Emma does not want to be a part of the system. Very much is resilient, knows how to fall through the cracks. So even with every minor that we have at the Joe Chrysler shelter, DHS CPS is being called every night. The follow-up and the ability of these youth to be stealth is uncanny. So Emma enters the teen center and kind of minimally accesses supports, but is on our radar. And Emma knows about the teen center through cousins. Emma has a couple older cousins that have come through the teen center and know the services that are offered. So Emma comes in, eats some meals. Emma stays at the shelter sometimes. DHS CPS is called, but still. Emma is finding a way to fly under the radar and gets outreached by us, of course. But, if a youth has been through the system and maybe had a negative experience with a counselor, if they were forced to take meds, if they were assigned a counselor and had no say in it, if I go up and introduce myself as a therapist, they laugh in my face. So I have to build a relationship in a different way. So we use humor quite a bit. Oh, you ready for counseling yet? Well, knowing that that's like the last thing that they want. But Emma knew of the services that were available into the collaborative, was really embedded in street culture, hanging out with their friends, getting high, getting drunk, spending time with their older cousins. There's an impulsivity sometimes with youth around, like, you want to go get high? Yeah, go see where the day takes you. That could take you any number of places. What happened with Emma is that her behaviors, ultimately, when she was under the influence, led to several situations, but ultimately an assault. And that was kind of the gateway into because there was Department of Corrections involvement, that was the gateway into kind of mandating an option for substance use treatment. And that is ultimately what led to Emma being screened and entering Day One residential. And because, I work for Day One, I know Kristen, she's the manager of residential, there is a collaboration that works really well in terms of wrapping around these youth and hopefully getting them the most support that we can.
So I just wanted to do a little snapshot of residential, and then I'll jump on where Cheryl left off. But just to give people a picture of what it's like here at the Day One residential. Obviously, we do an initial assessment of needs, even though we have heard about this client from Cheryl or from other people that we might work closely with. We want to sit down with the client and, see what her story is and what her thoughts are about what she's looking for. And then once a person is admitted or appropriate for treatment at the residential, we have a lot of different aspects that we look at. And we try to address the things that maybe have gone off to the side while they were under the influence or while they were out in the world seeking substances. So when they come into this home, we're trying to address healthcare issues. We're trying to see where their education is and whether or not we can help them get to a place where that once they leave, they're on a little more steady footing. We look at their relationships, whether it's their peer group relationships, the relationships that they have at home, how they interact with us, And we look at how substance use plays into all of that. And then we also look at the, life skills and recreation. A lot of times we're taking kids to the beach and they're not really sure what to do there. They, have never built a sandcastle, or they don't know how to, play a game at the beach until someone else initiates that. So day one residential really is about looking at the whole person and seeing, where can we help them in this moment have the surest footing when they leave, so that they'll be in a better place. And I was actually talking to one of my clients as I was building this slide and saying, these are the things that I want to talk about. Am I missing anything? And she said, yeah, don't forget to talk about the house and like what you guys do here, because this isn't that our residential facility isn't a facility, it's a house. So it's very much geared towards being a home environment to create as comfortable a space as possible. And we also have a trauma-informed perspective that we use inside the home. So we try to mimic a safe, comfortable house. We also do not put hands on clients. So if clients are having a hard time and they're escalating, we really do try to use more de-escalation practices as much as possible. And clients are aware of that. So we're really building this community and culture of working towards safety. So with all of those things in consideration, we look at Emma at residential. So as you can see here from this slide, she had 2 experiences with res. And before I jump into those, one thing that's important to note is somewhere between Cheryl's interaction with Emma and her coming to residential, she had a brief stop in the Juvenile Corrections Center. And during that time, they did a medical workup, and they were very concerned about some things, and they decided to do something that I think is called a med wash. Jeff, you can correct me later if I'm wrong, but they took her off of all of her medication. And there was a reason for that at the time, and she was admitted to residential with no medications on board. So thinking about that, could go really well, could not. We weren't sure. We wanted to see how she was going to land in treatment. And she had a brief stint back on the streets before she entered residential, maybe I think 2 weeks. So not on medication, back on the streets, and then suddenly admitted to residential, where surprise may be that she didn't really want to be. She had folks saying that this was a great choice for her. She had Department of Corrections saying, we really encourage you to try this. But Emma's experiences, to Cheryl's point, counselors had either let her down in her opinion, or she had previously been in residential and that didn't really seem to work out for her. So why on earth would she want to be there? So she had a lot of barriers to being open to accepting treatment. She, didn't really have a lot of insight around her substance use and how that was causing problems. But in the meantime, in the milieu, as we're trying to help support building a safe environment for Emma, that actually maybe was a little bit triggering for her. And she was dysregulating all of the time. And, let's go to group. Nope, that was hard, though there was a lot of triggering topics that were discussed in there. And so eventually, after a very short period of time, Emma had escalated up and down to the point where people were at risk of being physically harmed, and we had to ask her to leave. In that period between episodes, we, had all of the different folks who have been working with Emma during this period of time get together for a team meeting, because we knew, she doesn't just need to be back on the streets. She doesn't need to be with her family who isn't really doing, it doesn't have the skills on board to be helpful to her at this time. How can we help? Emma is also being faced with whether or not she needs to go to be incarcerated because she wasn't able to complete her treatment. So all of us get together and we say to Emma, these are your choices and how do you want to handle this? And she said, I need to see someone about my medication. If I'm going to go back to residential, I'm not going to be able to do this with nothing to help me. So that was a huge step for Emma. She did meet with a med manager who was able to get her on some medication, which Jeff will talk a little bit more about as we move forward. But that really helped her come into her second episode of treatment more prepared, and a little more open to the process, a little more open to being able to create relationships. The triggers that she was experiencing would not lead her into dysregulation as quickly. She was building some coping skills. And that came to the point where she was really doing some fantastic work around her family relationships as well as her intimate partner relationships, both of which had a bit of a rocky history. So as she was doing that work, however, the triggers intensified. And again, we saw Emma get to a place where she was being physically unsafe with staff involved, and she had to discharge. And I just want to highlight the differences between 2 weeks in treatment and 3 months in treatment, because in this situation, even though Emma ultimately left, that 3 months was a significant amount of treatment for her, given where she entered.
Thanks, Kristen. Just going to touch very briefly on what you alluded to, the medications. You know, what we do see, a couple comments. One, this is not all about opioids. What we're seeing in our adolescents are polysubstances, and a fair number of those can be really hazardous in the withdrawal environment. So combine that with this list of medications. And I think we have definitions for those or uses for those in the chat room, but the different medications that she had been on or off over the years, there's some pretty powerful antipsychotics, there's antidepressants, there's ADHD medicines, clonidine for calming and other withdrawal symptoms. So, you know, picture what we know about discontinuing even a street drug and the emerging mental health issues that come from that, and add to that discontinuing prescribed medications and what's going to happen. I think Kristen alluded to that, her dysregulation. I mean, she needed to be on something, most likely, not all of these, of course, but was now detoxed and away from any calming or sustainable medications for her ability to settle down into recovery. And we did see a little bit of a settling down in recovery when she did get back on some medications. But the lesson here is really going cold turkey with anything is a challenge. And the emergence of the mental health issues that can be have been buried for a long, long time can be one of the more difficult things we do with our adolescents as well as adults. So, all right, next slide. Rich, I think you're up to talk a little bit about education.
Thanks, Jeff. And I'll try to be brief, but the important thing for everyone to consider is that Maine does acknowledge the specific needs that these kids have, and to that end provides funding to school districts that are willing to take on this program. Currently, the girls program is based in RSU 15 in Gray, New Gloucester. The girls attend school at the Gray, New Gloucester High School. The Department of Education funds that directly to RSU 15. It provides for a certified teacher, who in this case is also a special education high school teacher. We have an educational technician that's also involved with the girls. And then we supplement the program with trauma-informed yoga. Beth Jones, our yoga instructor, has much experience working with UNE and the health occupations about trauma-informed yoga. And we've supplemented their work with art instruction and outdoor recreation. We are in the process right now trying to reestablish our boys program. We're hoping it will either be at Gray, New Gloucester or at Wyndham, where we are hoping to have our next residential facility for our boys. It's also important to keep in mind that what we try to do in this case with Emma was to get her to the point that she could sit for her high set, the former GED high school equivalency. Keep in mind that she came to us with an 8th grade completion at 17 years old, quite a daunting challenge ahead. So again, we spent a lot of our time working individually with the girls and the boys to provide for their education, hopefully high school completion. We've had a number of successes that have gone on to post-secondary and into the workforce as well. So lots happening in education. The education is provided to the residential treatment program, and we do the best we can with what we have and try to keep people very much engaged.
Thank you. Thanks, Rich, very much.
Good. Are we going to have this next breakout, Chris? I think what we would like to do with time is to get you back into your working groups.
Actually, Rich, I think I'm going to need to change the plan a little bit on the fly. We're starting to lose people here in innovation as they have to run back to class. So I thought it might be great to just open this up to have a conversation with everyone about this question. So if you could put in the chat, or if you're in innovation, or if you're in Biddeford, if you want to raise your hand, talk to us a little bit about what you could bring to this individual. What does your profession have to bring to this individual? Anyone on the panel want to reflect on that question a little bit?
I think that one of the things that we've tried to convey to you today is all of the different professions that we at Day One come in contact with or have on our staff. It's a work in progress. The number of kids involved with substance use is growing. And there's a real need, as we've discussed and people have asked, some help in getting things better coordinated among all of the different organizations involved.
This is Jeff. As we heard, most of these clients, like Emma, have very lacking social determinants. They are in need of dental care, physical care, nutritional knowledge, STD evaluation, and the list goes on and on and on. So a number of the disciplines that UNE supports are certainly would be helpful to many of our clients.
Do you want me to hop in, Rich, and talk about where Emma is now?
I think that would be great. Cheryl, do you want to kind of help the group understand where Cheryl is on September 8th?
Sure. So, oh, you mean Emma? Sure. So Emma, after leaving residential, made her way back into Portland, and being at the teen center, you see people come and go. So it was clear that she was still with her primary partner, couch surfing, staying with friends, in and out of the teen center for a meal here and there, but pretty low profile. But they're enough that they were able to link with their teen center caseworker, who helped them apply for a voucher that's available right now. And that voucher is for youth that have been in the foster care system, have spent time in DHS custody. So she is in the process of obtaining her own apartment, and she will be living in that with her boyfriend. And their relationship isn't perfect, but I think we have to make note of the fact that, relationships are so important. Connections are vital, and the fact that they've sustained their connection through all of this turmoil and homelessness, really says something. about their connection. I know from observation that they are still actively using marijuana and alcohol, probably dabbling with other substances as well. In terms of accessing the teen center, when someone's housed, people can still come for appointments. So I'll continue to offer counseling, mental health, and substance use. And usually when people are more stabilized, they might likely connect. Through COVID, my program has done some telehealth, and we've found that to be highly successful with some of the more chaotic youth who aren't able to prioritize coming into an office, setting a time, sticking to it. I text with my clients I have a work phone during the day, so I try to provide some flexibility. So I'll probably do some more outreach with them. And if Emma wants to pursue any employment or education, they are able to come into the Street Academy and work on that. So I consider Emma to be a success. They're alive, they're housed, and they're, connecting with other people. So that's my Emma update.
Thanks, Cheryl. And part of today's presentation, we're hoping that we've piqued your interest in what it is that we're doing, and that you have ideas of things that you might like to try as part of your graduate program. Gives me great pleasure to introduce Tricia Mason, the Director of Service Learning, who will talk to you a little bit more about where we're hoping this project will go.
Thank you, Dad, for that introduction. Thank you for joining us today. And as we say, we hope that we have sparked your interest in co-collaborating with residents at day one, building relationships with them, and really learning from, with, and about each other. We have an opportunity to begin some pilot programming with day one this fall. We are hoping to have a student meeting the week of September 27th. You'll see the QR code on the screen, as well as a flyer that was attached in this chat by Michelle that gives you some more details on what we're hoping to accomplish. We're interested in your ideas, your perspectives, and what unique strengths that you each bring from each of your perspectives and your professions. So following this presentation, we'll get students and faculty together to meet with day one and talk about how we might meet residents' needs and create some programming together, hopefully in person, maybe by Zoom, with those residents either on the day one campus or on the UNE campus, and really work together and learn from each other. So hope to see you as part of those opportunities.
And finally, get ready for next time, where we're having our next event is Cracking the Zip Code, Decoding Environmental Injustice, and thinking about what some of the bigger predictors of health and well-being are. So thank you, everybody. I'm looking at the chat, and there's lots of thoughts going on, and we welcome you to put anything else or ask any questions. So thanks, everyone. Thank you, team.